Do you know who sucks at managing pediatric pain? You suck. Do you know who else sucks at managing pediatric pain? I suck. How do I know that everybody sucks at managing pediatric pain? Well, there was a study in 2004 by Simpello where they actually looked to see how many kids who presented with fractures were actually treated with analgesics. And what's the number? Less than half. And as it turns out, general emergency physicians and pediatric emergency physicians were equally horrible at this. Another study in 2014 by Kircher showed that the average delay for children in pain in the emergency department to receive analgesic was over 2 hours. Now, there's a number of myths that exist about pediatric pain. The first is that kids don't feel pain. If you still believe that kids don't feel pain, it's time for you to retire. Kids feel pain all the time. Why else would they be crying so much? Another common myth is that children with appendicitis or query appendicitis should not get opioid medications to treat their pain because it's going to mask the symptoms of the appendicitis. As it turns out, total bunk. There was a study in 2014 by Punai who actually showed that it makes no difference in the diagnosis of appendicitis if kids have received opioids or not. So get these kids comfortable. It's in their best interest. How hard is it to actually identify children in pain? Well, all you have to do is grab a FACES scale. These things are easy to carry around on your PDA, on your phone, in your pocket. It makes it easy to manage the patient's pain if you actually identify and measure it first. There are a number of options for actually managing pediatric pain, including pharmacologic options. One of the things that's been used for a really long time is codeine. Are you still using codeine? If you are, you've got to stop. Canada Health says we should not use codeine in kids 12 and under. Why is that? Because for some kids it works great. Yeah, well, you know what? For some kids who don't metabolize codeine, it doesn't work at all. And for kids that are hypermetabolizers, turns out these kids go apneic and die. Do you want a dead kid on your hands? I don't. Look, there are a number of great options for managing pediatric pain. Things like acetaminophen, non-steroidal anti-inflammatories, intranasal fentanyl, oral morphine, using lidocaine, epinephrine, tetracaine gel if they've got a laceration, using a topical analgesic if you're starting an IV or doing an LP. Get on board, use one of these things. There are also a lot of non-pharmacologic options like using sucrose for infants, using an infant warmer for infants, using things like distraction therapy or music therapy. All of these things have been studied and shown to work. No side effects, low cost, high efficacy. St. Augustine said it best when he said that the greatest evil is physical pain. My advice to you is don't be Dr. Evil, manage pediatric pain well.